Hello, everyone, and welcome to a new session with Rights and Responsibilities Awareness Initiative. Again, we are lucky to have Ernest Johnson, mental health expert, to talk to us about sport and exercise and mental health. Ernest, thank you so much for being here with us today.
Thank you. This is a topic that is very personal to me. I'm a former athlete, and I very much have seen the pros and cons associated with exercise and its impacts on mental health on a deeply personal level. And I think it's something that's important for all people, really.
So, sir, how you would see the importance of sport and exercises in helping within the mental health issues?
Well, there are several points where I could go with this, but I think one of the things that often gets lost when discussing mental health is that we will often see mental health is only responding to a crisis or something tragic or when there's an overt problem, and not see how we can tend to mental health on a routine maintenance basis. You wouldn't just brush and floss your teeth or just go to the dentist if you have a cavity. You'd do preventative and maintenance stuff and engagements in order to ensure your dental health. And mental health is the same. And that's something that tends to get lost and tends to get stigmatized in discussion of mental health, and exercise is certainly a part of that. On previous discussions we've had, I've talked about the Mental Health All Stars, and the Mental Health All Stars is born of a project actually done by the University of Calgary many years ago that highlights um, aspects of human interaction that are good for mental health. And really quickly, and obviously I'm going to emphasize exercise in this discussion, but those facets, there's 12 of them. There's creative outlet, routine, sleep, meditation or prayer if you're religious serves the same purpose in a lot of ways, social activity, healthy diet, love, sun, air, humor, therapy, and exercise. And so basically, exercise in and of itself does lots of things that are very good for your mental health. And our human physiology is designed well, basically functions like our ancestors roughly 10,000 years ago, ballpark. And those ancestors would have had a huge degree of social interaction and social physical interaction, um, engaging with the world around them. In fact, there is a theory about running in particular that is related to human evolution. It's called the Running Man theory of human evolution. It's got some traction. It's not universally accepted, but the long and the short of it is that human ancestors became bipedal before there was kind of universal growth in brain size. And human beings are the slowest, weakest, kind of most fragile land-dwelling mammal out of the larger land-dwelling mammals in the world. However, being bipedal gave humans one unique physical advantage, and that was aerobic respiration. In other words, most animals can sprint and scamper away very quickly um, with anaerobic, without oxygen, bursts of exertion. But those bursts have long recovery periods. Like a cheetah sprinting after a game animal will take a very long recovery period after sprinting, faster than any other land animal. And human beings can maintain a relatively high effort aerobically with oxygen for a much longer period of time than any animal. And this developed um, something that's called persistence hunting. And there's actually two indigenous peoples in the world today who still practice persistence hunting: the Tarahumara, who are indigenous to the Copper Canyons of Mexico, and Kalahari Bushmen, who are indigenous to the northern fields and northern prairies of South Africa. And basically, in persistence hunting, humans would gather in small social groups and chase after a game animal, and the game animal would sprint away. And then they would chase after the game animal, tracking it, communicating with each other. And eventually, after several repetitions, the game animal would lose the capacity to significantly recover, and the human group would capture the animal and harvest it. And this practice um, potentially predates human growth size. So, or human brain growth size, sorry. The growth of the human brain. Man, I messed that up. And the the theory is that humans' capacity to move aerobically was a key piece in humans' evolution. And so, with that in mind, endurance sports in particular have a unique impact on the human brain. Regular participation in endurance sports improves brain capacity, improves the brain's ability to recover from some types of trauma, and also it acts as a preventative measure for Alzheimer's and other diseases of older brains. Um, and frankly, endurance sports also have a very significant impact on anxiety and depression in a very good way. So I'm going to refer a little bit to my notes here. Endurance sports release feel-good endorphins, and there are natural chemicals in your brain that improve a sense of well-being. Um, and also, they have a meditative quality as your body is moving through space for a long period of time. That has a meditative quality, which tends to cause people to lose sight of their worries. And to be clear, endurance sports, it doesn't you don't have to be a competitive world-class cyclist to experience this. It could simply be going for a walk for 45 minutes, in particular in the woods, but wherever you might be. It could simply be, jogging, jog walking in the woods or what have you. I don't want to give the impression that this is something that's unattainable or something that is out of reach for most people. It can be the simple act of walking. Now, obviously, there are limitations to that, um, but the benefits are achievable by a huge cross section of people. This type of activity also impacts mental health because you gain confidence. And it's very easy to see progress, which allows one to develop a sense of confidence and like they can tackle issues that may be in front of them. Exercise, in particular, outdoor endurance sports exercise, tends to lend itself to more social interaction. So just like in the Running Man theory of human evolution, there are small groups working together socially, and being out for a walk with friends in the woods, for instance, or wherever you might be, produces a great deal of social interaction, which also helps with depression. And also, a lot of times when people have clinical anxiety and depression, um, a lot of the coping they might turn to might be coping that in the moment is, alleviate some of the symptoms, but ultimately over a period of time is maladaptive and harmful. And exercise is a good way if your brain is used to exercise in a way to address feelings of depression or anxiety, that will become a go-to for you, and it's much more pro-adaptive than some, depression and problem drinking are correlated, or anxiety and problem drinking are correlated. And if one uses exercise to cope, it doesn't have it doesn't have a lot of those maladaptive impacts. Um, Sorry, I'm perusing my notes. Now, i- as I said, it can be any physical activity for a longer period of time will impact these or cause these benefits to arise. Now, a lot of people use planned, structured exercise strategies, and a lot of people um, are a little bit more ad hoc. And the truth is, as long as you're active regularly, it doesn't really matter. Whatever gets you out there and active. So anything that's enjoyable, that moves your body, has tangible benefits on anxiety and depression and your general sense of well-being. Now, it has to be something that you enjoy doing. It can't be, some like being a competitive athlete is a lot of work and has a lot of stress inherent with it. And simply put, you don't have to engage in a way that has that inherent stress. Um, and you have to set reasonable, achievable goals. I'm going to walk around the block 3 times a week, versus this arduous, structured, almost militarized expectation of a routine. Now, to be clear, um, a lot of times, in particular in social media, there will be this narrative presented that anxiety and depression can be cured by exercise, and there'll be narratives around, medication is ineffective, therapy is ineffective. We can have cures for this anxiety and depression through exercise, and that's actually ultimately a very, very harmful narrative. Um, the causes of depression are a lot more complex than not moving your body. And while being physically active is a huge benefit and helps with those conditions, it is not simply a matter of someone with depression just needs to get up and move and they'll be better. And frankly, that message is very damaging to someone with depression because it infers a narrative of pull yourself up by the bootstraps in order to address your depression. You have nothing to worry about. Just get going. And ultimately, that drives people away from treatment and away from exercise. So, away from aspects of a lifestyle that is inherently healthy and into a lot more of the maladaptive coping and a lot of the maladaptive and damaging features of depression. Now, there's some very, very tangible impacts that exercise also has on addiction. Um, so, long story short, addiction is basically a relationship with a mind altering substance or behavior that the individual doesn't have control of, doesn't want the consequences of, or at least some of them, but cannot stop. And there's a great deal of loss of control. And with that, a great deal of guilt and shame, and also a great deal of rationalizing the addictive behavior or blaming it on others or what have you. And regular exercise can counter some of those cycles in your brain. There was a study in the University of Edinburgh in Scotland, I believe in 2004, but I'd have to look it up for the exact detail. And basically, it was for people who were engaged in a day treatment, day inpatient. So they spent all day in treatment, but would go home in the evenings, um, treatment for alcoholism. And basically, the control group was a population that went to this treatment. They were all first timers in treatment, the control and the experimental group. And then the experimental group went to the same treatment, but also in addition did a structured and catered to interest and ability exercise program after the day treatment every day. And this was, I believe, a 12-week experiment for these individuals. And what was found was that those who participated in the structured exercise program had a 96% reduction in relapse, i.e., returning to use of alcohol when they're in treatment to prevent alcoholism or counter alcoholism. And it was abstinence-based treatment, not harm reduction. And so there was a huge impact. And there's a few takeaways from that. One, it has to match the interest level and the capacity of the individual. And two, engaging in that way is very helpful for the mental processes related to addictive drinking. So, I mean, those are two areas in which there's clear benefit to exercise. However, it's not as simple as exercise cures these issues, and exercise is free from challenge or concern. Something that has become more prevalent in young men certainly has existed for years, but has become more prevalent. And women can get this too, don't get me wrong, and older people can have this as well, but it's very prevalent for young men. It's called body dysmorphia, or colloquially known as bigorexia. And bigorexia is basically a a subtype of body dysmorphia. And body dysmorphia is a hyperfixation on um, the flaws in one's body. It can be with wider body dysmorphia, it can be lines on the face, which we all have. It can be blemishes on the skin or scars or what have you. And with bigorexia or body dysmorphia, the focus is on I'm sorry, muscle dysmorphia. The focus is on the physical appearance and size of your muscles. Now, the symptoms of muscle dysmorphia are repeated studying oneself in the mirror and being very judgmental of any perceived flaws, avoiding mirrors because of negative body image, a very strong adherence to a super strict exercise and diet regimen. And I want to be clear, there's other cases where people would have that. So it's not that every time that's present, would it be muscle dysmorphia. Um, a want and willingness to stick to an exercise routine, even if one is sick or injured or physically in pain. Um, Willing to sacrifice social goals and important events to maintain this routine, or even missing work to maintain this routine. um, often a hyperfixation on the use of dietary supplements, and then, frankly, steroid use. Now, this is almost a sidebar topic, but I'm going to delve into it right now as part of the mention of muscle dysmorphia or bigorexia. Steroids are they are substances called anabolic steroids, which have a significant impact on the body's ability to build muscle fiber. And they're very effective in doing so, and they certainly enhance athletic performance. They've been around since the early 1970s or late 1960s and have become more and more prevalent and more accessible. And a lot of the images of muscular bodies that we see in sport, that we see in movies, that we see in professional wrestling or WWE are bodies that use steroids to achieve the physiques that they have. And in 2007, there was a report in baseball called the Mitchell Report, and they identified, I believe, over 100 players as being known steroid users. And that's a very significant number because at every given moment, there's roughly 800 major league players. So it was over 10% of the player population. And the size of NFL, NHL, and NBA players since 1970 to current has gone up proportionally with basically the same ratios that major league players have gone up. So it goes to show that there is usage of performance enhancing drugs in those sports as well. Just because realistically, a average size going up that has maintained the same ratio would not be achieved without some of the same factors, which includes steroids clearly. And so in body dysmorphia or muscle dysmorphia, individuals with this disorder will compare themselves to other images and the male bodies that they see. And those tend to be disproportionately steroid using bodies. And long story short, some of the discussion around steroids is a kind of akin to the reefer madness discussion of marijuana in the 50s, in that a lot of the negative effects are unrealistically embellished, and it creates this binarial discussion. The truth is, there are some bodybuilders from the 70s who lived well into their own 90s, um, who did use steroids in competition and lived to be very healthy. But that does not mean there isn't significant drawbacks. And anytime one is, a competition use of steroids is roughly 20 times the natural testosterone levels in your body. And there's a whole slew of mental health challenges associated with that. And basically, people are more reactive, more prone to anxiety, more prone to um, violent outbursts or reactive outbursts. So there's a lot of perils associated with steroids for mental health. Some people can use them and be okay, but it's a huge risk. And frankly, physically, if one uses steroids, their endocrine system stops producing as much hormones, and they'll either be as much testosterone, and they'll either be at a deficit once they stop or have to maintain use. And a lot of former athletes will do testosterone replacement therapy because of their habitual abuse of steroids has caused the endocrine system to never produce enough again. So muscle dysmorphia or bigorexia is related to exercise, and it's negative for mental health. There's also exercise-induced anorexia, and basically it is a subcategory or a sub condition of anorexia nervosa, in which people will count their calories and really restrict the amount of calories they have or not eat at all, and exercise to the point of with a focus on burning off anything they might consume. And this can also include exercise in which one is injured and also in which one, just like with muscle dysmorphia, where one is skipping social responsibilities or even work in order to engage in exercise. Um, there's also a huge fear of weight gain and a want to measure one's body size and weight over and over. And basically, this is a pattern that is tied to a preoccupation with being overweight, which is often very much um, outside of most people's conceptions and certainly medical conceptions of being overweight. And again, this is a subfeature of anorexia nervosa, and it can be embellished by excessive exercise with a focus on excessive caloric burn. So, like anything else, there's tremendous benefits to exercise, but it is something that needs to be done intelligently and honestly and with a balanced viewpoint. Human beings were not meant to engage in any sort of one way with the world. There's not one way to exercise properly, but there is benefit from exercise and there's drawbacks potentially with certain subcategories. So yeah, that's exercise and mental health. In short, I was trying to keep it around 20 minutes and basically get out there and be active, but also be balanced.
Thank you so much, Ernest, for this fruitful and wonderful presentation. It's just enlightening me personally on a lot of things. So yeah, it's a great recommendation, especially with this weather.
Oh,
Now we are
absolutely.
close to summer, so
We're like flirting with summer.
sunshine, warm weather. So get out, enjoy the nature, move out. And of course, as just as you mentioned, everyone is different, so everyone has different capabilities, different interests. So if I may say, yeah, find your interest, find what is more suitable for you, and go for it.
Absolutely. Like walk in the woods, play soccer with your friends, whatever it is.
Thank you so much, Ernest. So, and at the end of this presentation, I would like to express my sincere thanks to Ernest Johansson. Thank you so much, Ernest, for being here and for those wonderful presentations, all of them that you have done for us. We are so grateful to you and to your help and support, sir.
Well, thank you.
And for everyone, as always, stay well, stay safe, and we are looking forward to see you at another sessions with Rights and Responsibilities Awareness Initiative.